Good evening, guys. Today I am also adding a series on the line of MAD concept and you for you ECG concept. And I am trying to make it more easier for all of us because ECG is one of the things which we, as a healthcare professional, also not just our doctors or the nurse, we all should know who are dealing with the healthcare. So let's start our ECG concept by P wave. Now, before uh, going for the P wave, we should know SA node is the pacemaker of the heart, which is situated in the superior aspect of the right atrium. Now, from SA node, it depolarizes right atrium followed by the left atrium. Now, the P wave is the wave which show the depolarization of the atrium. Now, just some basic concepts. You have to see lead 2 and V1. These two leads, V1 is a chest lead and lead 2 is a limb lead. These two leads are the main in which we generally assess P wave. So, what is the normal period duration of P wave? It is 99 millisecond plus minus 12 millisecond. So, what it signify that if the duration of the P wave is more than 110 millisecond or approximate 3 small boxes, it is prolonged and it definitely denotes some atrial abnormality. We will discuss further. And what is the normal height we have to take in a standardized ECG? I will definitely going to cover this where I will describe what is standardized ECG. But before this, a basic concept for you: 10 mm in vertical height or the XY axis is equal to 1 millivolt. So normal height is up to 2.5 mm or 0.25 millivolt of the P wave which we consider. But normally above 0.2 mm P wave you have to be suspect a right atrial abnormality. But normal is 0.25. Just keep it in mind. We will discuss this aspect also of 2.5, 0.25 millivolt or 0.2 millivolt. But the normal for you at starting is 110 millisecond, that is 99 plus minus 12 millisecond duration, and the height is up to 2.5 mm or 0.25 millivolt. So just you can see just a P wave followed by QRS and a T wave complex. Just a introduction to the ECG, how you see a in normal person. Now I have already told you normal P wave evaluated in lead 2, limb lead 2 and chest lead V1. The third thing, always when we are assessing a P wave, we have to also see frontal plane P wave axis. Now we will, so from here onward, whenever whatever we are going to discuss about P wave, we will cover in these three aspects. So let's start with the lead 2. Now in lead 2, generally the P wave is pyramidal, okay, and the apex is rounded apex. It is very important point because when we cover our right atrial abnormality and left atrial abnormality, there are situations where apex, if it is conical, you have to consider the right atrial abnormality. So here just a first basic, the P wave configuration is going to be pyramidal in lead 2, apex is going to be rounded, limbs of the P wave is going to be smooth. If you see, I make a diagram for you guys, and the duration I have already discussed, 80 to 110 millisecond, that is 99 plus minus 12 millisecond. And what is the maximum amplitude a P wave can have? That is 0.25 millivolt or 2.5 mm in a standardized lead. Remember bachcho, this is a standardized lead. So we have to understand standardized lead, it is 10 mm equal to 1 millivolt. Now this, what is the axis? Normally 40 to 70 degree is the plus clockwise rotation. The axis of the P wave is there. So now the second lead is V1, where we have to check for P wave. It is having two components, lead V1. One is initial component followed by the terminal component. So if you see in the EC, the initial component is this one, the positive component which is going up, followed by the, if you see, there is a downward and there is a negative component of view. This is a terminal component. In V1 this is a normal because V1 see the heart from a direction where the right atrial activation is directly towards the V1, which gives you a positive inflection, followed by the the followed by the left atrial depolarization, which create a negative terminal component. Now, what is the characteristic of V1? So you see it is a biphasic. If you see, it is biphasic. Second, it is having a composite deflection. I have already explained. It is having two components. Initial positive components. Terminal components is the suggesting of left atrial is. So what is the maximum voltage here? If you see in when you are considering the lead 2, the maximum voltage or maximum amplitude of P wave is 0.25 millivolt, which you are going to consider. But here in lead V1 chest leads, you have to see in right atrial abnormalities or the positive deflection. I will say this, the positive deflection. This is up to maximum 0.15 millivolt. And what is the depth? That is negative deflection from the isoelectric line. Left atrial axis, it is 0.1 millivolt. So remember, there are three amplitudes which you have to remember when you are considering P wave. First, you have to consider the limb lead 2. Limb lead 2, P wave can have amplitude up to 0.25 millivolt or 2.5 mm. In V1, where it is biphasic, you need to see the positive amplitude will be up to from isoelectric line is 0.15 millivolt maximum, and below isoelectric line it can be 0.1 millivolt. I made a diagram so that you can have a at least roughly idea how the heart atria is situated. So you have to, there is a catch point here. Anatomically you need to understand one thing. In V1, why right atrial is positive? First of all, right atrial is above the left atrium anatomically. It is anterior and left atrium is posterior. And V1 is looking from the chest. So it is more looking to the right atrium, and when the depolarization of the V2 is happening, it is towards the posterior direction. So you can understand why the left atrial activation is having a negative deflection. Now the third thing which you have to see for the P wave, what is frontal plane P wave axis. Now frontal plane is lead 2, it is showing normal. I have already explained, plus 42 plus 60 or 70 degree you can consider is clockwise direction. So if a patient is having a more than 70 degree, it is right axis deviation for the P wave. Now mind it, it is a P wave. I am not talking about a QRS. We will talk when we discuss the QRS complex. Here, if it is less than 40 degree, it is a left axis deviation. So left axis deviation less than 40 degree and 70 degree and above is right axis deviation. Now how will you identify? Now remember one thing, you know that the axis of the lead 2 is around 60 degree. So the normally the axis of the P wave is more towards the right axis. So more towards the lead 2, sorry. So it is more positive in the lead 2. But if it is right axis deviated, so you have to consider up to 90 degree, 70, 90 degree. We will discuss the condition like COPD, chronic cork pulmonale, in which the right axis deviation is there. You will find the more positivity in the lead AVF. So you can change the leads also as per the clinical condition, but mainly you have to see whenever you assess is lead 2 and V1. So now the catch point here is clinically sinus tachycardia, shift axis of P wave plus minus 10 to 15 degree towards right. So always remember the patient is having a tachycardia which we considered more than 100. That is a basic thing which we know. If it is there, in those patients, it shifted axis to the 10 to 15 degree in the positive clockwise direction. So it become more prominent in lead 2. This is also having a significance we will discuss when we discuss abnormality. So I ended the basic for the P wave. So what is P wave? It is atrial depolarization. So where which is the pacemaker of that? SA node, which is situated in the right atrium. So first right atrium depolarizes followed by the left atrium. So lead to directly seen is more in the axis of the atria, and lead V1 is showing anteriorly to the right atrium, and as a left atrium is a posterior. Anatomically, this is the concept you need to remember. So what is the normal duration of the P wave? It is 99 plus minus 12 milliseconds. Okay, so plus minus 12 seconds. So if anything more than 110 milliseconds is abnormal. We will discuss. Generally it is showing left atrial abnormality, but we will discuss later. What is the maximum height of P wave in lead 2? It is 2.5 mm or 0.25 millivolt. When we go down, so whenever you are evaluating a P wave, you have to see in lead 2, limb lead 2 and chest lead V1. And third thing which you need to always assess is what is the frontal plane P wave axis. So just a revision of the features, normal features in lead 2. In lead 2 you will have a pyramidal, rounded apex, smooth limbs, and the duration will be 80 to 110 milliseconds, and maximum amplitude I have already explained, it is up to 0.25 millivolt or 2 mm in a standardized ECG. This is very important, you have to check. Then we will go to lead V1. In this, P wave have two components. Initial component is positive, terminal component is negative. Initial component show right atrial activation or depolarization, and later it is negative component is the left atrial activation. So maximum right atrial activation amplitude can be 0.15 millivolt. So what was in lead 2? It is 0.25. Here in V1 it is 0.15. Left axis deviation 0.1 millivolt depth. Now anatomically basis I have already explained to you. Now last thing, you have to check for the frontal plane P wave axis. Normal is plus 40 to plus 60 or plus 70 clockwise. If it is more than plus 70, it is right axis deviation, where the you can see clinically it is cor pulmonale or COPD. And if it is less than 40 degree or left axis deviation, generally congenital heart diseases. We will discuss later in our next segments. Point to remember, if the patient is having a sinus tachycardia, you have to see a axis of shifting in the 10 to 15 degrees. So what it shows, it is more towards a lead 2. So the P wave in lead 2 become more prominent. Thank you so much. So we are ending our this session here. Next session we will discuss the atrial abnormality. Thank you so much.